Welcome to the Savvy Giving Gal podcast. I'm your host, Melissa Torelli-Smith, and today I'm thrilled to welcome Lisa Sweet to the podcast. Lisa is the founder of the Sweet Beginnings Diaper Bank, where she distributes thousands of diapers to families in Contra Costa County every month. I hope you love our chat. Lisa, welcome to the podcast.
Well, thank you very much. And now I don't have to say anything because you've done it so well.
No, there's so much more. There's so much more to you, I am sure. And
I'm like totally impressed.
Well, I'm impressed with you and I'm really glad that you're here. Can you start by talking about why you started the Sweet Beginnings Diaper Bank?
Oh my goodness. I'm going to try to make a long story really short. I am a registered nurse, as you mentioned. I do pediatric advice for John Muir Health here in Contra Costa County. But before that, I was working for Children and Family Services as a foster parent liaison. And when that gig kind of was coming to an end, the funds were disappearing, I had to decide what I wanted to do. Did I want to go back into a full-time nursing role, or I really liked working and teaching and working in adoption and working with the foster parents. So I thought, I think I'll become an adoption facilitator. And I did. And so for the next 10 years, I facilitated private adoptions. And while I was doing that, I wanted to be able to help the women in the community who were parenting, the ones that I had met working at Children and Family Services, who I felt weren't getting some of their needs met. You know, it's really hard to have your child taken away from you and have to go through the court system to get them back when you're not giving it any direction or education to do that. So I wanted to provide some of that. So I started doing some parent training and I opened up a clothing closet and I started recycling baby equipment and started providing diapers. And as the process grew, I saw the need for diapers growing. And at some point I had to decide, where do I want this growth to go? And so as a registered nurse, I looked at the diapers and I knew that need was growing. And I reached out to the National Diaper Network and got some more information about how to do it and why. And went nonprofit and became a diaper bank.
I love it. I just love how you saw a need and you decided to fill it. You're like, there is a need here and I want to fill it. So can you talk about where you distribute the diapers and how you pick the families and kind of how it works?
Yeah, so they kind of pick us.
Okay.
And we do a direct distribution once a week in Concord. And then we also collaborate with a lot of community partners. So we work with WIC, we work with Employment and Health Services, we work with First Five, Head Start, all of the other nonprofits in the communities that work with families come to us. And and public health nurses and Healthy Start. And so we'll provide them with diapers that they can take back to their organizations and hand out. And then they also refer their clients to come in and see us. So once a month, they can come pick up 40 emergency diapers. Newborns up to 4 months get 60 emergency diapers and a pack of wipes and also feminine hygiene products if they need them. We have lots of books that we give out that people donate because I think that reading's really important. Huge. And bond. We teach our families that, when you're changing a child's diaper, to sing with them and read to them. And so we try to do a little parent education at the same time with the people that we're touching. But yeah, it's a community event.
Yeah, what a blessing that is to them to also, not only get the diapers, but then also kind of get these amazing services that you offer because, not everybody, even people who have all of the things we need don't know how to parent or need help parenting or need a book to read to their kids. So it really goes beyond the diapers. But, what was a defining moment that you realized something as small as the diapers, the wipes, or even the feminine care products could create such a big impact in the community?
I think it was, I don't know that there was really a defining moment. I think it just kind of happened. The numbers just, every month the numbers grew. I mean, I went from, giving out 40 diapers a month to giving out 15,000 diapers a month. And it was just a gradual process as people learned what we were doing. In the work that I had done with Children and Family Services and working with vulnerable families and working with birth mothers, homeless women on the street and families, I knew who was out there. And I knew that what I didn't want to do was I didn't want to do handouts. I wanted to do hand-ups.
Oh, I love that.
And so we just kind of developed a program where that was the process, that was the focus. There are so many things. I mean, a diaper is just not just a diaper.
Right.
It's not. It's a basic necessity. Children don't get to decide on their own how many clean diapers they have a day, and it just impacts so many different things. I mean, it impacts their health. The diaper rashes, if you have to leave a diaper on a child for 10 hours because you can't afford to go out and get diapers. There are women who will take the lining out of a disposable diaper and rinse it and hang it so that they can reuse it. Yeah. People use dish towels. They'll use Kleenex. They'll use socks. So it's the diaper rash. There's a possibility of urinary tract infections, and it increases the amount of emergency room visits because a lot of people who don't have health insurance have no other choice except to visit the emergency room, which that cost itself, when you're insured, is what it is.
Yeah, it's a lot.
If you get
ridiculous.
the bill, you see how much those things cost. So that drives up the costs in our community. It impacts women's emotional health. When they can't provide a diaper for their child, I think it's something like 76% of women who can't provide diapers for their children are depressed. And when you're depressed, you can't bond with your child. And when you can't bond with your child, I mean, it's a vicious circle. Yeah. A diaper costs 15 cents.
That's crazy.
I mean, if sometimes people will say, well, why do we have to give a diaper to somebody? Why are they having kids? If they can't afford to give diaper to their children, why are they having kids? And I have to say, if you're a mom and you're a parent and you know how hard this is, how could you say something like that?
Imagine. I mean, I know that there are people out there who say some stupidity like that,
Yeah.
but I just can't imagine that someone would equate not having the diaper to not being able to have kids, or you shouldn't have a child.
Right.
I mean, these women should, and they're great mothers. They just can.
Yeah, they just need help. It's hard. I mean, as an advice nurse, I work with a spectrum of socioeconomic people, and I'm answering calls from Pittsburgh and Bay Point and Alamo and Orinda and parents who have an education, who have money, who have family to help support them, have to call and ask questions about what to do. And so what do you think these people who don't have those support systems are doing? Would you rather see them get their children taken away from them? Would you rather see the number in foster care go up? I mean, it's so easy to provide diapers to somebody.
Right. It's these simple, and it is a complex issue, the diapers, but the diaper itself is so simple, but the impact is so huge. And I think if people took a step back and realized that the impact they can make by just donating a box of diapers to your organization is just, it really goes so far beyond taking the time to do that if you have the funds and the time to do that. And so I really do believe it starts with those little things in philanthropy where we're helping someone on such a basic level in our community.
Yeah, and that's basic is a great word.
Yeah.
It doesn't take a lot of, there are people who might not have time, but you can put I have a board member who keeps a jar on her desk at work. It's a swear jar.
Yeah.
And so every time somebody in the office swears, they
love
have to
it.
drop money in there. Guess who gets that money? I get it.
Oh, I love that.
Yeah.
Oh, that's
So
amazing.
there's so many little things you can do. You don't have to go out there and start a nonprofit.
Right.
It's
And she's making giving fun. I mean, that's kind of a
Yeah.
fun thing to do, but you know that money is going somewhere super impactful, and it's a way for her to incorporate giving into her life to help.
Yeah, and it helps me buy some of the little things that we need in the office, tape, because we
Yeah.
repackage diapers into groups of 20, or paper to make the labels so that we can brand our diapers, because I don't want to spend too much money on a sticker.
Right.
It's I'm really frugal with the money that I get donated, and it's really important to me that, when people are donating money, they know where it's going. And so that swear jar is so important to me.
I love that concept so much. I might implement that in my home too.
Yeah.
So you don't just distribute diapers and wipes, you distribute feminine products as well. I want to talk about that a little bit and how important feminine products are to these women as well.
Yeah, so the women actually stay home from work. They miss school, middle school, high school, because they may live in a family that doesn't, especially young women, live in a family that doesn't have enough money to buy the products. They're very expensive. They're not, the average family in our community, we live in one of the most expensive counties in the state of California.
Yes.
But there's about 20% of the people who live here who make below poverty level, salaries. And so they can't, they may be getting some help, a little bit of assistance with TANF, and I think that people think that that's an exorbitant amount of money. But when you're only getting $1,000 a month to help pay your rent and help pay your utilities and help buy food for your family and help, pay for school supplies and all of these other things, and our average rent here in this county is $2,500 for a one bedroom, how does that work if you're only bringing home $2,000 a month?
Right.
So many of the families that we provide for work.
Yeah.
It's just that they don't make enough money to survive day to day. And so the period products help these girls go to school or prevent them from wearing a sock or, bunching up paper towels.
Right.
Schools are getting really good about posting things in the girls' bathrooms that kits are available and having them in the office if they need to go in and get them.
Is that why you added that to just knowing the economic status of all of these people that you help? Is that why you added that to your nonprofit, that added that feminine, or did you always carry that? Did you always
No,
decide?
we added it knowing that could help. I mean, especially for the women that are coming in, it's just, it doesn't, we repackage into 6. We don't even give anybody a whole package. It's just 6. It's an emergency pack to get them through. Because it's like, I think it's like 3 out of 5 women can't afford to buy products. Yeah. And for diaper statistics, it's 1 out of every 2 families. That's a lot.
That's a lot. Yeah, that is a lot. I mean, I remember thinking when my kids were little how expensive diapers were when I went to buy them, and I wasn't, in a position where I needed the help at the time. So I can only imagine when you need to buy milk, bread, formula, you're picking that over the diaper or a feminine hygiene product, which is a really sad reality.
Yeah, because you can't substitute. Milk is milk.
Right.
I mean, a pad, you can use something else, but how, and there's no dignity in that.
Yeah.
Why do we want to keep people from feeling less than who they are?
I mean, and like you mentioned earlier, there really is a ripple effect of that feeling as well. So it's not just about the diaper or the feminine product. Like, they're able to go to work, they're able to have self-esteem. I mean, it really just goes so far beyond the actual product. in these categories because it gives them the ability to thrive.
And feel good about themselves. And when people work, they pay taxes. And guess where those taxes go? They go back into our community.
Yeah.
So it's if people don't have diapers, they miss work. And they can't take their kids to preschool. Kids who go to preschool statistically go on to higher education.
Yes.
I mean, it's amazing how many little things affect what something so small can help. I mean, I have 4 children, and my husband and I had our first child, and then 16 months later we had twins.
Oh boy!
So I had 3 in diapers at the same time.
Sorry, I'm a little stunned right now.
And then we waited 10 years, and then we had our last one.
It's a great story. Okay.
Yeah. So I get diapers, and we make a good living, and it was still hard.
Yeah. Why do you think that diapers and diaper insecurity is sometimes overlooked or misunderstood?
That's a really good question. And I, as a nurse who works in a pediatric clinic, it's something that bothers me. I bring in diapers and I keep them there. We have a really large Medi-Cal population in my clinic. And so when the doctors do a well visit, one of the questions on that visit is, are you worried about food security? So they all get asked about that, but they don't get asked about diaper security, which is my next goal.
Okay. So
to
I
get
love
that
goals.
On that list.
Okay, Lisa, here we go. Okay.
Yeah.
No, that's a fantastic goal because that's an important question when a mother is going in for a well check.
Yeah.
Can she provide this for her kids?
Yeah, and if they can't, let's provide her a resource for that. It's. And if they can't, if they're not going to get it at a diaper bank, let's hook them up with a public health nurse that's going to come into their home. And, or if we know there's diaper insecurity, what else is going on in the home? Yeah, so let's hook them up with something else. We get somebody else coming into their home. We get some other resources provided for them. The public health nurses love our diapers because it allows them, they might call a family and the family will say no. They don't want somebody coming in. And they say, well, I have diapers. Oh, please come.
Yeah.
And so then they can go in there, they can take a look around, they can offer so many other resources, get kids into preschool that parents didn't know existed. And so.
Yeah, I mean, I think it's a way in the door. I love that. And I think that goal of getting that question onto that form is such a great one because like you said, these women really do want that help. And if you're not going to ask, they're not going to provide the fact that they need the help. They're not going to tell you they need the help. But if you ask them, they might.
Yeah, they will. And the National Diaper Bank Network does a study every year. They collect statistics there's 250 diaper banks nationally. There's 16 here in California. And it's a nice network because we can connect with each other and ask questions and maybe implement something that we aren't doing that's successful for somebody else in their community. But they do they get money for research and studies, and 2024 they asked women about it, and 78% didn't want to share that information. Oh my gosh! Because it just was so embarrassing that they couldn't provide for their children.
Well, as a mother, you have 4 children.
Yeah.
I'm
still providing for them, and they're much older now.
and I have 2. We always are forever, right?
Yeah.
And I have 2 children, and I can say confidently, I would be so upset and embarrassed if I couldn't provide for my children. It's like an innate need to protect and provide. But we shouldn't feel shame if we need help or we can't do that. It doesn't make us less of a mother.
Right.
And so we need to get these women around someone like you who doesn't make them feel shame, but offers this help and this guidance. And even the fact that I'm going back to the books because you're showing them what a great mother you are. Here's a book you want to read to your kids. they are wonderful mothers. They just need help.
And they don't have support systems, many of these women. Or they've come from another country, or and they don't have any other relatives or friends around yet. If you can get them hooked into programs like First Five, where they do co-op preschool so that they can meet other moms, so that they can have circle time. And these organizations also have dads come in and do dad groups, and we have so many dads that come in to pick up diapers, and I know that's got to be hard. Yes. And then and then they're picking up feminine hygiene products as well, and that's really got to be hard.
I bet that's really hard, because there's a lot of men who don't even want to go to the drugstore to pick it up for their wife or girlfriend or whomever.
But they're so grateful, and it's when we find that sometimes when we age out our children at 4, and then they get a potty training kit. So they get a potty ring, they get a book, and big kid underwear, and some instructions for the parents to help them. And they'll bring back diapers, because we repackage diapers. So they'll bring back diapers, and it's their way of helping give back what they've gotten. And for the most part, we have people who take advantage, of course. There's always people who take advantage. Yes. But for the most part, most of our families will only stay in the program for a year or two max. Some of them are only 6 months until they're back on their feet. So they're not, we like to tell people, we don't provide free diapers.
Right.
We provide emergency diapers to get them through that gap every month. Again, it's, about dignity. And if you can do it, I don't understand why.
I don't either. Honestly, anyone listening, it is a very, very simple thing to contact Lisa and provide a bag of diapers. Even when you go to the grocery store to teach your kids, let's pick up a box of diapers for another family.
Right.
Just like anything else. People donate to food banks. They pick up extra food for the food bank. I think that diapers and feminine products, especially for women, is very relatable. And when we can give back and feel like we can relate to what we're doing, I think that's a really big thing too. So I'd encourage everyone to and start small. I think with giving, you give 1 pack of diapers and you see what you can do with that. You don't realize that 1 pack of diapers affects how many women. 10 women, 50, I don't know. I don't know, the statistics better than me, but it's not just 1 pack of diapers helps one person. This box probably helps multiple families.
Oh yeah. And the 40 emergency diapers will get them through, newborns up to like 3 months will pee 8 to 10 times, so you're doing that many diaper changes.
We know.
Yeah. And then, as they grow up, it becomes less, but most children should be peeing at least once every 8 hours. So that's, 3, and if they're having, I don't know, should we talk about poop? But
yeah, we can.
it gets, you're using 5-6 diapers a day. Right. So those, if we can provide just that to get them through that. Yes. And Safeway has diapers all the time, 50% off, Yeah. And we do have people that do that, they just bring in a thing of diapers once a month for us. And we're just so grateful for that. Or the repackaged diapers, when people move up a size or we don't ask for large, I want the large.
Of course.
I want lots of money and I want the large amounts of donations.
Let's put that in the universe.
Yeah. Yes. But I'm grateful for just 5 diapers, if that's what you can give us.
Yeah. I love that. So you're 100% volunteer organization, right? So can you talk about how important the volunteers are to run what the project you're doing, the nonprofit you're doing?
They're so important, and I'm going to name them right now. They're so important.
I do it.
I do have to start with my husband.
Okay. No, he's number one, right?
Yes, he is. Cheese. Oh my gosh. He does so much for the diaper bank that people just don't see, including putting up with me in my most vulnerable moments. Then I have 3 people on what I call my dream team. And those are the people who help support my emotional health.
Oh, that's good. We need those.
Yes.
We need those people in our life.
And they also donate, but that's Jennifer and Teresa and Terry. Terry's also what we call the diaper fairy because she mysteriously brings us these diapers all the time, or I find them on my porch.
Love a diaper fairy.
Yeah, I'll find them on my porch, and I'm like, Terry's been here. My little fairy. Then I have a group of women who come in during the week and package things, organize things, get them ready for our distributions on Wednesday. I have Lisa, who's been volunteering with us for 7 years.
Oh, wow.
Diane, who's been with us for 6 years. Jennifer, also one of the board members, 6 years. I have Kathy and Patty and Julie and Sandy. And these women are there on Wednesdays, and they're the face that people see. And a couple of them are actually teachers from my children's elementary school.
Wow.
Yeah.
I love it.
Yeah.
I love that.
I love it too. And that's what's great about our community.
Yes.
You know, my children all went through the same 3 schools and had great teachers, and to be able to maintain those relationships and work with them after my children have grown is just...
It's special.
Yeah.
Yeah, there are a lot of really special women in this community who really want to get involved with someone doing something really special like you are. And so I think you attract that. You know, I think when you're doing really good things, you attract women who want to also do really good things. Can you share where the Diaper Bank is?
Yeah, we're in Concord. We rent a space from a church, First Christian Church on Willow Pass Road.
Okay.
And it's really nice because there's a food pantry right next door to us, and they're open the same time we are. Oh. And I'll give a plug to the library, who's going to be doing free lunches on Wednesdays from, I think it's 11 to 1.
Okay.
So we do our distribution from 11:30 to 12:30.
Okay.
So you can get a free lunch and you can get some free diapers and it's like an outing.
Yeah.
And the food pantry is in next door to us. So
like
you
a
can sign up for those
one-stop
services. Yes.
One-stop shop.
And I wanted to just circle back to volunteers in the community and give a little plug to a great organization that works with families promoting mindfulness. It's Mindful Littles, who is in Lafayette, and Tanuka, isn't she?
She's amazing, yes.
And she brings in families with little kids, and they do diaper drives for us, and then they package them, and they put in these cute little notes and pictures, and if it's Christmas, they put in a Christmas card, and they remind people how special they are on these notes.
Yeah.
And so I couldn't do what I do without organizations like her and the churches that donate and do diaper drives.
Right. And I love that you brought that up too, because the fact that she works with young kids and she's teaching these young kids to give back, and you're mentioning the impact that these young kids are having on what you are doing. And yes, she facilitates it, but I really love that. I really love that she has taken these group of children and not only done her mindful work with them, but also added this giving component where they're like, oh, I understand what it means to give a diaper or a book. Like, I understand that. So let me do that for these people, you know? And so
it's so great. I love the pictures when she brings me pictures after of everybody doing it.
Yeah, it's a really...
I don't want to be around all those little kids while they're packaging those diapers. So
I don't really
That's
either.
what she's really good at.
She is. She is really good at that. But families who are listening, you can get your kids involved by doing stuff like that too, or get involved with Mindful Littles, or, you know, an organization that is doing something like that where they're teaching philanthropy for the kids and then distributing the diapers to an amazing nonprofit like yours. And
brownie groups are great. Girl Scout groups, Girl Scouts who are getting or Eagle Scouts who are getting their merit badges. Or they have their special projects as they're aging out. They're great projects, you know. Companies, real estate offices are wonderful donors. Yeah. They love to donate. I have Remax in Walnut Creek who does one for us almost every year. And and
it's an easy way at a holiday, or, you know, I've made it my mission to turn these, you know, different holidays, birthdays into a way to give back. And diapers is a great thing to collect at those times instead of a present or a hostess gift. A lot of things that we don't need in this community. Instead of doing that, you could collect diapers for Lisa, and it would be great and super impactful, more than a candle or
Yes.
something that we definitely don't need. So what advice would you give someone who notices a gap like you did? You noticed this gap with diapers and feminine hygiene products and wants to do something about the gap.
I think the best way to get involved is to do a little bit of research. You find something that you're passionate about, find something that you can help out with in your community, and then get on the internet and do a deep dive. Who else is doing this in the community? Because you don't want to start something brand new if somebody's already doing it. Collaboration is great. I mean, we can do so much more when we collaborate.
Yes.
I couldn't give out 15,000 diapers a month if I didn't have people donating them.
Right.
And that's collaboration.
Absolutely, yeah.
Even though it's not always planned. So find out, make sure that nobody else is doing it. And if they are, then find out if they need some help. You might be the person that they need to drive things to the next level. You might have ideas that they just got stalemated on. That happens. I've been running this nonprofit for 10 years, and there are times when I'm just like, done, and I have to reach out to people for that support so that I can keep going. Of course, I keep going. I haven't stopped. I know I need to.
No, you shouldn't. I don't know. I'm encouraging you. It kind of leads me to my next question. You really dedicate your whole life to helping others. I mean, you're a mother of 4, but then every job you have, you are someone who helps other people. And now you have this nonprofit who helps thousands of people. How do you make time for you in all of this?
Well, I have my great husband.
Yes.
39 years in August.
You should.
He's a good guy, and he's very nice looking.
Yeah.
And we have a trailer. We have a camping trailer.
Okay,
so
good.
we try to go
that.
out with that at least once a month.
Okay.
And we travel together. We love to travel. So
and get out in nature, right?
Yes.
Yeah. Well, I love that because you need to refuel if you're going to help all of these people. I mean, we all do, right? It's a lot. It's a lot to emotionally even take on. I mean, because it's a lot to see all these people who need your help all the time.
Yeah, it does get hard, but to watch the growth in the families that you're able to assist kind of takes over that.
Yeah.
It makes it a little better. I also have 2 really great best friends, Kim and Diane, who I can text in 2 seconds. And so that helps. It just really helps to have a circle.
I say this all the time on the podcast, that my girlfriends are truly my everything. I mean, they are my support system. I can run anything by them. And I encourage everyone listening to have those couple great friends where you can vent and you can say pretty much anything you want. And then they help. And then you go back to doing all the amazing things.
Yeah.
I mean, we need women who really lift us up and support us and let us, vent and have pain. And then they're there.
Yeah. And they just send a little heart and they don't have to say anything else. You know what they're thinking. You don't need to hear that part.
That's right. That's right. Or they tell you and you're like, oh, I did need to hear that. Okay. I'm sucking it up and going back and doing what I need to do. So
there are a lot of really great communities of women here in Contra Costa County. I think, we mentioned that the Lafayette, Orinda, Moraga, Alamo corridor. There's so many organizations, in Danville, there's Danville Children's Guild. And we just got $4,000 from an organization called 100 Women who donate quarterly, I mean, so those are other ways that you can get involved if you don't have time,
right.
And you get to have some feminine company and maybe meet your next best friend. And
right. Especially when you join an organization like that and you care about philanthropy. Obviously, you're around 100 women who also care about philanthropy. And so right off the bat, you have a common interest.
Like-minded people.
Yes. And then you find your people within that. So I really encourage everyone to spend time with the women in their life.
Yeah, me too.
Good women in their life.
Good women.
Yeah. So what gives you hope when the need feels overwhelming? Like what how do you kind of come back to that hope and that vision that you started this with 10 years ago?
I think it's again, it's the thank yous, and because I take probably, and this may seem small to some people, but 10 calls a week to me is
It's a lot.
It's a lot,
It's a lot.
and when people are saying to you, "We really, really appreciate this," that's really makes all the difference. That's that one little thing and not that you want the acknowledgement, but when you hear that out loud, that you've helped.
Yes. Yes.
And so I think that's what keeps me moving forward again. And other people that I know. I mean, like, I get up in the morning before I go to work, and I have this friend who used to say, "I know Lisa's going to post 3 times." So he sees the first one, he says, "There's another one coming," and then he sees another one, and just to get positive feedback from your Facebook community, even.
Totally. Yes.
Yeah.
Yes. Like, I see you. I see what you're doing, and I look forward to seeing what you're doing next.
Yeah, and it's not that, again, it's not that you want the acknowledgments.
Yeah.
It's just that somebody's seeing that somebody's being helped.
Yes.
And
that you're touching the lives of other people. That's what a thank you is, right? That you're taking the time out of your life to help someone else. And the thank you is just, okay, I am doing what I set out to do.
Yeah. Now come help me.
Yeah, exactly. Now I need your help.
Where's my diapers?
Yeah. Donate, So before we wrap up, I always ask my guests these last 3 questions. So first, what does it mean to you, Lisa, to be a community change maker?
Well, I thought this might be coming. And I was going to say, please don't ask me that.
Yes.
I don't know, because I don't know that I'm so much a change maker.
You are. And this question is funny. It's always, I interview change makers on this podcast, and it's always the most difficult question, weirdly, for them to answer, because most of my guests are so humble like you, but you are a change maker. So,
well, thank you. I think just knowing that I'm not sitting back and complaining, maybe, and that I'm doing something about, it's that I'm not just throwing things out on Facebook. I'm actually walking it.
Yes. Yeah.
And I want other people to do that.
And you're encouraging them. I really think that one of the things that makes you a great community change maker is that you're not only just doing it, you're encouraging other people to do it as well. And you're bringing them into your fold and giving them a place to do it. So I think that
I hope so, because none of us is better than the other.
No.
We just all have a different circumstance. Some of us have been luckier than others. Some of us haven't. And so.
And none of us know when that time's going to come where we're going to need help.
Yeah.
And we're all going to need help at some point, and so I think keeping that in mind is important as well.
Yeah. I've been actually saying a lot about that in our recent, climate. It's like, I know it's easy for you to say right now that certain things shouldn't be going to certain places, but you don't know what's going to happen to you tomorrow. That's right. You don't know what's going to happen to your parent tomorrow. You don't know when your children grow up and have children, what their needs are going to be. Yeah.
Yeah. I think people, and this is my own personal opinion, I think people need to step back before they say things like that, or think that they'll never need help. And so why should they help someone else? Or, I really think everyone should take a step back and think about that because there is going to come a day that someone needs help, and you don't want them to be judged for that or not have the help available to them. So next, how has helping others impacted your own well-being?
I think that it's helped my own well-being by hearing what my children
I love that.
say.
Okay, so what do they say? Tell me what.
I mean, that they, they may argue with you every single day, and they may do stupid things every single day.
They do,
But but they have your back when it's most needed, and and the things that they say about how much they love you Yeah. I think it's my children.
Yeah, I love that. And they must be so proud of you.
Whoops, I'm going to cry.
No, I know I might cry. I think we both might cry. No, I mean, they must be so proud of you because, you pour into your kids forever, but for so many years when they're young and you do your best. And then when you do have a relationship like that, when they're older, it means everything.
Yeah. And I think I have four pretty good human beings.
Love it.
Yeah.
Well, if they're your kids, they have to be. And your amazing husband who I haven't met yet. But I mean, the two of you together are like a powerhouse parenting couple. So I'm sure they're amazing.
Yeah, thank you.
And so finally, can you share one simple act of kindness that our listeners can incorporate in their daily lives?
I'll go back to knowing that, not just thinking, but coming to a place where you know that you're not better than anybody else.
Yes.
Because that's when you become a community member.
I love that. I love that. I think that if everyone walked through life with that in mind, people would help more. People would give more. And so I think everyone listening should hold that in their heart all the time.
Yeah.
So can you share with our listeners where they can connect with you and the Sweet Beginnings Diaper Bank?
We have a Facebook page, Sweet Beginnings Diaper Bank, and that's where the most activity happens.
Okay.
We also have our website, sbfrc.org, which I'm not great at keeping all the time, so Facebook page is better.
Okay.
And my phone number's on there. They can text me anytime they want. Texting works so much better than phone calls because I'm able to multitask with those.
Yeah. Yes.
Yeah. And or show up at the diaper bank on a Wednesday from 11:30 to 12:30 on Willow Pass Road.
Okay. Go say hi to Lisa on Wednesday.
Well, I won't be there.
Not Lisa. She'll
but
be
you can say hi
nursing
to the others.
But all the volunteers she
Yeah.
mentioned will be there, and you can say hi to them. So,
Yeah.
Lisa, thank you so much for being here today. I really appreciate you taking the time to talk to me.
Well, I'm so glad you reached out to me so that I could share all this stuff with everybody.
Yes, me too. Me too.
Coming to fill up my cup.
Thank you for listening to the show. I hope it sparks a desire in you to dedicate even a small slice of your life to uplifting others. Don't forget to subscribe wherever you listen to your podcasts. Follow me on Instagram at SavvyGivingGal. You can also visit my website at SavvyGivingGal.com. Let's spread positivity together.